Welcome to the very first episode of the Meridian Walk Podcast. I'm Tennille Jacobs, a trauma-informed holistic wellness coach and co-founder of Meridian Meditation, and I'm also a student in traditional Chinese medicine in the advanced diploma program.
And I'm Kat Nguyen, co-founder, ethical marketing lead at Moon Meditation, and a fellow student in the TCM Advanced Diploma Program. This podcast is where we sit down with practitioners who are living and breathing this medicine every single day. So students like us and anyone listening can learn from real stories, real experience, and real wisdom.
Okay, perfect. So to launch our very first episode, we wanted to begin with someone who has shaped many students' understanding of this medicine, including ours. He's a registered traditional Chinese medicine practitioner and a doctor of TCM, and he's also one of our professors.
And he prefers to be introduced simply as a student, a teacher, and a practitioner of traditional medicine. Aric, we're really honored to have you here with us today. Welcome.
Thank you for having me.
Welcome.
Thank you.
Thank you. Okay, so Aric, we'd love
Yes.
to begin with the part of your story that sparked this entire journey. So we got your, what you told us about that. You had mentioned that you originally planned to get into genetic research and then possibly Western medicine before stepping away from academia. So can you take us back into that time? Like what was going on with this original path? What was happening for you? And, when did you start pivoting away?
Sure. I've always been sort of growing up interested in a few things really. But when it came to sort of career pathing, I've always had the idea that I might want to go into something healthcare related, right? Um, Helping people and whatnot. And, the thinking at the time was more so along the lines of, well, if I want to help people, I might as well make it efficient, right? Because if you are a practitioner, hands-on, seeing patients one at a time, you're using tools to help the patient, right? Whereas if you go into research, you are the one sort of making the tools that many people use. And the idea was kind of like, well, I would be able to help more people that way. Right. That was the original sort of the idealistic way of thinking, I suppose. But obviously, uh, actually, thinking and then doing are two things. Oh, what got into, fast forward to university, got into, human genetics and bioengineering, all that good stuff. And, it got to the point where it just got super dry. And it was not engaging. And, I started to think to myself, well, am I really, going to spend the rest of my life doing this? Right. I'm just
Right.
like kind of, dealing with this dry stuff and just, and, if I may say, like, that period of time sort of, made me become rather disillusioned with the world of academia. It was just kind of, in my head, it was just kind of like, okay, you guys, need to get off your high horses and just, just chill for a bit, and so I needed some time away from that and to sort of just rethink and reset and then think about what is it that I actually want to do. So I stepped away from all of that and started discovering, sort of thinking, not really discovering, more so sort of exploring my options, I guess, as it were. And as I mentioned in sort of the little questionnaire that you had me filled out before, um, the you know growing up in Canada as a Canadian-born Chinese, um, I always felt I was out of touch with my culture. Like, we obviously, as a family, I grew up with a lot of Chinese culture but you're still sort of away from it. You're not really growing up in that environment. And in Cantonese, we have a saying or a term that we use for sort of people that were born overseas, and that is a bamboo stick. Okay.
Okay.
So if you
Do
if you
tell.
think, yeah, and so like if you think about a bamboo stick, right? So bamboo sticks are kind of like in a compartment, right? It's like a stick. It looks like a stick, and it's kind of hollow on the inside, but it has these sort of partitions in the middle. You can't kind of look down a bamboo stick and see the
Without
other end. You know what I mean? And so the idea is that in Cantonese we say long tao batong. That means that both ends are blocked up. You can't just go through from one end, right? So you're kind of stuck in between, right? You're not really close to the your original roots, like your ethnic culture, because you're away from all of that. But at the same time, especially I find as sort of a visible minority, right? As a visible minority, you might speak the language well, right? Fluently, first language even. You might grow up in sort of Canadian or North American culture, but there is still this sort of disconnect, I feel,
yeah,
right? People look at me and the first thing they see, oh, Asian, oh, Chinese, right? We're like, it's I'm not saying that it's not inclusive. I was very fortunate to grow up with very little in terms of sort of discrimination and racism, right? Of course, everyone gets a bit,
yeah,
right? But I was very lucky to grow up in a very sort of inclusive environment, but you still feel that sort of disconnect from the local culture. So, being sort of in between those two spaces, you kind of crave a place to belong almost,
yeah.
right? And you know, I started kind of like leaning more into my own culture. I was like, well, I've always been interested in Chinese culture. I've always been, um, interested in my roots and all of that. And I also have I have an uncle in Hong Kong, and he practices traditional Chinese medicine, and he also teaches actually.
Okay.
Um, Not as much anymore, I think, but anyway, the year, or I should say the summer before I went to university, I spent about 3 months in Hong Kong.
Yeah.
And so I got to talking with him about sort of, what he does experienced TCM sort of firsthand, taking the pulse, getting an intake done, getting some lovely tasting herbs.
Yeah, always.
As always. And so that was sort of my first real brush with TCM.
Yeah.
This was back in the summer of 2004. And so that sort of gave me my first taste, and it kind of stuck with me because and he also gave me a few books to sort of read and just sort of get myself acquainted with it. And it was sort of like a way for me to sort of tap into my roots, tap into my culture, and sort of going in with that. So fast forward 2 years from that, in 2006 was when I sort of stepped away from university and stepping away from the science and all of that stuff. Um, and so I thought, well, why don't I sort of give this a shot, give it a try? Why not? Right. And so that's when I found TSTCM. I called up Mary. I was like, hey, this is my situation, and can we I wanted to get like learn more about the school and so on and so forth. So I went did an interview with her and all of that, and then boom, September of 2006. That's when I started my first semester at TSTCM, and
Wow.
here we are. What is it like?
Lifetime ago.
20 some years later. Yeah.
That is amazing. So I'm curious, like, so at that point when, for example, when you got that stuff from your uncle, right? Um, what was it, if anything, that made you really think, apart from just, we want to connect with the culture, but there's something here. Like, what was it that you saw in this to say, okay, let's go there.
I don't know that it was more so that like, oh yeah, let's go there. It's more so just, I guess, the exposure in and of itself to it. You know
Mm.
what I mean? And it just kind of planted a seed, sort of. It wasn't really um, necessarily at the time that I would be like, yeah, this is what I want to do. At the time, it was just more like, okay, this is something maybe I can keep on the back burner, or something that I might look into, kind of like as an interest project, or as a hobby, or just casual reading, or whatever it might have been. It was just something that was just kind of put in the back of my mind, kind of thing. And then it wasn't until that what I was actually doing was like, okay, that's kind of reached a dead end, type thing, that I started to look for other options. That's when I kind of grabbed that from the back of my head and say, hey, why don't we give this a try? So it was more that than sort of something specific that was like really
It was like,
struck my
this is the thing.
interest.
Yeah.
Yeah, yeah, it was something like, okay, yeah, let's go ahead and explore this. Like this is something that I had just a taste of. Let's see where it leads.
Well, I mean, listen, it kept you here.
Here I
Right?
am, right?
And
I'm
honestly, I
still
mean,
in
because
it.
when you think about it, genetic research can be pretty interesting, but the fact that this got you here, yeah, that's pretty amazing.
Yeah.
Okay, so I want to talk a little bit about, so as you can tell, from the trauma informed perspective with us, there's a lot of talk about the mind-body connection, trauma, somatic health, and these are all like catchphrases, so to speak,
Sure.
in what's emerging in Western medicine. But coming into TCM, I'm finding that all that these words are doing is confirming what TCM's already known, right? So I'm kind of curious, where does TCM fit into this larger conversation that we're having right now with these, trauma-informed somatic healing, holistic care, that kind of stuff?
Sure. Yeah. And I mean, first of all, I guess we can say that TCM has had a lot of time to sort of steep, so to speak, in sort of different cultures and so on. It's been growing for so many different years, and in so many different places. And the thing about TCM is, one of the first things you learn about TCM is that it is what we consider to be a holistic medicine, and we sort of look at everything, right? Um, there's really no such thing as specialization in TCM. It's not like in Western medicine where, oh, you got to see this particular doctor of this specialty that specializes in this niche part of that specialty, and that, they get cut smaller and smaller and smaller pieces, which I mean is necessary because sometimes these diseases can be very, very complex, right? And I'm not really sort of poo-pooing on that side of things. But TCM runs on a sort of different platform, so to speak, where we sort of consider a lot of different things and sort of talking about that mind body connection. And that's something that is, I think, at the core of TCM, really, where um, there is a, within the theory of TCM, there's so many different theories. Like one theory, for example, is the theory of your Shen, or your spirit, right? And as we know, our spirit is housed in the heart and so on and so forth. But essentially what your Shen is there are two sort of definitions, right? We have a broad definition and a more specific narrow definition. The broad definition of the term Shen really can mean anything sort of having to do with spirituality. And that doesn't necessarily have to have, religious connotations. I mean, it can, right? It can be used to refer to, for example, a god or something like that. But, it also has to do with your own spirit, whether you want to call it your soul or whether you want to call it your consciousness, the way that you experience the world. When you refer to me, myself, and I, that is your Shen, so to speak, right? But the other part of Shen is in TCM is your vitality, right? When you look at someone, you can kind of tell, even without having a so-called trained eye, without being educated in TCM, when you look at people, you have a general idea of their health, right? You can sort of look at someone, if they've got nice bright eyes, they're looking straight at you, they're talking really loudly, and they've got energy. They're healthy, right? But if you see someone, they're frail looking, they're tired, and they don't have the spirit in their eyes, that vitality in their eyes. So that is the Shen, and you can sort of zoom in to the body and see whether it's either Shen, or you can kind of look at the body overall and see if there's Shen. So the vitality is a reflection, it's an outward manifestation of what's going on inside the body, right? And so there are different things that contribute to that. Obviously, your physical body, your bodily functions um, correspond to that, right? The better your body condition is, the more healthy your outward appearance is, right? Um, and the other part of it is also your state of mind. You might have a very healthy body, but if your state of mind, if your headspace, you're in a bad place, that also outwardly can, there's nothing physically wrong with you. You go for a body check, nothing wrong, right? But when someone who's under a lot of stress, maybe you haven't seen your friend in a while, maybe because they've been, buried under a huge workload, and you go see them finally for the first time in 6 months, you're like, oh my God, you look like you've had better days,
Yeah,
right?
right.
Right. And they might not be suffering physically, but mentally, right? You can see it, right, on the outward. And so that sort of body mind connection, and sort of as it fits into the, I think you said sort of trauma, and how trauma can affect the body. More and more back in the day, in sort of more old school, approaches to medicine, is more so, hey, you're physically fine. You've got a healthy body, you've got nothing to worry about. Just, I know it's a little bit of stress, suck it up,
Yeah, yeah.
right? Just suck it up, right? And more and more, there's been sort of this slow but constant shift towards, hey, maybe it's not that simple, right? Hey, maybe there is this sort of, we've been underestimating really the um, effect of stress and the effect of emotions, how it can affect your body, right? I'm reminded of this TED Talk
Mhm.
that I've watched, right? With Dr. Alan Watkins. He's a neuroscientist, and he talks a lot about sort of how something as simple as just breathing, right?
Mhm.
Having a certain regular breathing pattern can go on to affect your heart rate, can go on to affect your state of mind, and how sort of it goes from that physiological level into affecting your thoughts and your behaviors and your thought patterns. And there's these multitudes of studies also that sort of, when you purposefully, right, you might not be very optimistic right now, but if you purposefully go practice gratitude, look for the good, that sort of trains your mind to go and look for the good. Whereas if you're constantly looking at the bad, your mind will go ahead and look for all the bad, right? And so that sort of, that training of the mind, and the way that it affects your body, it's a two-way street. If you can control your breath, you can control your thoughts, you can control your actions, but your thoughts and your actions and the daily experiences can go back to affect your heart rate, your breathing, and your bodily functions, your hormonal balance, and all of that, right? And all of that fits really well within the TCM theory, where basically everything is connected,
That's right.
right?
Totally.
Everything is connected. And certainly, as we know, we have a theory of the five elements in TCM, which correspond to five organs, and each of those individual organs has their own emotions, right? And
Yep.
so when those emotions are overstimulated or out of regulation, it can also cause bodily harm.
Yeah. And this is what I think was the thing that stood out for me, especially once I got to actually see the theory, because we came actually, Kat's the one that guided us this way, because within the holistic wellness, I'm like, why does it seem like everything's so, this is here, this is there, and then we come to TCM and everything is there together. It's everything's in one place, so it's beautiful. And that was a big one when it came down to when I first learned about the five elements, and I'm like, it's right there,
It's there. Yeah,
emotions,
exactly.
it's so yeah, so that's amazing. Now here's where it gets tricky. So I imagine you've worked with patients yeah, in the academic setting as well as within your clinic. Um, and how do you feel that the two things, the Western medicine and TCM, inform each other? Because I gotta imagine, and I see it in class all the time, particularly people that have got a Western medicine background, they get stuck on the diagnoses. So I gotta imagine that also factors in clinic when dealing with patients as well, right? So how do you help bridge that gap between helping people understand that we're not, the diagnosis, that's not how we work.
Yeah, yeah. I mean, the way that I can sum it up is same but different,
Right.
right? It's basically the same thing. We're just like, the way that I often explain it to, whether it's patients or students, um, is, when you're trying to reconcile TCM and Western medicine, right? Um, the thing that you have to keep in mind is that they are basically, they come from two different cultures. They speak different languages, right? The TCM comes from Chinese culture, from it's deeply steeped in Taoism and very traditional Chinese philosophies, right? That are passed down from thousands and thousands of years. It's slowly evolving, but the core of it is still there, right? And the same can be said for Western medicine, where Western medicine is very much based on what we now call sort of the modern scientific method, as it were, right? Um, Very much steeped in sort of ancient Greek and Roman philosophy, right? And sort of trickling down into that philosophy of always fact checking and going down to like no nonsense. We're always based on the facts, right? There's no bias, trying to get cut out of the bias and trying to always second guess until you're very sure, at least as sure as you can be about the absolute answer to whatever question you're asking, right? So that's sort of the scientific method. And that's sort of the two different approaches, right? In Taoism, everything is connected, so on and so forth. It has its own sort of science to it, right? So modern science calls TCM theory sort of pseudoscience, right? Which is a fair assessment in my opinion, because if you go down to it, you look at TCM theory, there is so in Western medicine, there is a very physical basis for everything. You can look at it, you can test for it. There are things that you can do to convince yourself that this is true. But in TCM, it's kind of like this house of cards where all the theories kind of lean on each other. And if you go to the point where I doubt this theory, I don't think it's true, you take that card away, the whole thing comes crashing down.
Right.
Right? It The way that TCM is evolved is really through the lens of Taoism, through that theory and that philosophy. You're sort of observing the world around you and trying to explain it, right? Using Taoist ideas, right? Using Taoist theory. And specifically looking at TCM and Western medicine, they, coming from these two different cultures based on, they're like two different people, right? That grew up under different cultures, but they're trying to look at and describe the same thing, right? The human body, the condition of the human body, and the health of the human body, right? The diseases and all of that. We're trying to observe, analyze, explain, and ultimately treat the human body. We're like, the end goal is the same,
Same,
right? We
yeah.
just want you to be healthy, basically.
Yeah.
Right.
So one of the things that is actually quite interesting that I was when you mentioned the pseudoscience thing. So I'll tell you this, coming from the psychology background, I had a bit of difficulty with the scientific method, particularly when dealing with the human, because the scientific method requires a level of control, and every single human is extremely unique, which means that there are already built-in limits to how much we can control the human experience when trying to explore it. And so that's another reason why I love TCM, because the approach to healing is individualized. It's based on you, the person in front of me, and what you, the person in front of me, are experiencing on all levels. So I guess that's why, if anything, I would challenge the concept of pseudoscience. I think it's a scientific method that is taken in a way more individualized way than how we choose to see science from the empirical perspective. Because in truth, there's pattern recognition for generations, right? There's something that in itself is a form of science. And then the very simple fact that modern science is now, thanks to its technology, confirming things that TCM has already known in its practice, right? To reduce it to a pseudoscience or an alternative medicine, to me, feels a bit reductionist, because you're confirming what we've already known, and we didn't need the gadgets to know this. You know what I mean? Like, I know I'm talking weird, I'm not even there yet, but this is how I'm seeing it, right? Because I saw these limits, and now I'm seeing what TCM can and does do. And I'm looking at what Western medicine is saying, oh, this is new, this is fresh. And then it's like, but is it though? No, it's really not. So anyway, so I just had to challenge on that one too. I mean, I understand it may be the Western lens, and I can see it from the Western scientific method, how they view it that way. But the kind of science behind TCM is valid on its own. Right?
Absolutely.
So
Absolutely.
anyway,
Yeah.
That being said, sorry for my little takeover over
Yeah,
there.
no worries.
When you're looking at now, dealing with patients that may be dealing, they have got Western doctors, and so I always say that these two work together. They don't oppose each other. The outcome is the same, and it's often good to obviously have them working together. If you have a
Yes.
TCM doctor, you have a Western medicine, you're like,
Yeah.
you're good. So how do you bridge or work collaboratively, if anything, with patients that do have the need for a Western doctor as well
Mhm.
as a TCM doctor?
Well, first of all, I'll sort of preface that with that, I find that you do get the best results when you have a multidisciplinary approach, right?
Mhm.
Whether it's Western medicine and TCM or really, different forms of medicine as well. When we're able to sort of work together and collaborate, I find that's when you get the best results. And the certainly in China and many parts of Asia, TCM is integrated into sort of the mainstream system, right? That mainstream system is very well integrated in some cases where you literally have a TCM hospital or a hospital with a TCM wing, and where patients are treated with both things, and there will be collaborations and meetings between the TCM practitioner and the doctors and the nurses and whatnot. Everyone will have a meeting about that particular patient, so it's very well integrated. Over here in North America, um, we're not there yet, obviously.
Right.
Um, you know, uh, uh, Western medicine is very much the mainstream, and sort of all of the sort of periphery healthcare they use terms like alternative healthcare or adjunct healthcare. So we sort of have this sort of supportive role in North America. And while a lot of people will immediately look at that and go, well, let's make it integrated, right? But it's a lot of times it's not that simple. And so I think that the system and the infrastructure as it is set up right now, we kind of have to respect that, right? So first and foremost. Um, Now, having said that, when it comes to a patient that does need care from both sides, as it were, um, I find that it really depends on the individual sort of Western doctor that you happen to be collaborating with. Some of them are very open to it. Some of them are say, well, I don't really know much about it, but I've heard good things. You do your thing, we'll do our thing, and we'll just keep in communication, right? And that's usually quite good. Whereas some other doctors might be, and to give them credit, it's for the protection of their patient because they're under their care and they are receiving treatments that, number one, they don't really know much about. Number two, there aren't that many high quality studies, right? And Western medicine all about the studies and proving it beyond a shadow of a doubt that hey, this works, right? And sort of understanding the background mechanisms according to modern science. But in the absence of that, you can understand their apprehension. And a lot of the times they'll be like, well, I don't know how I feel about this.
Mhm.
Right. And so you sort of, and you get everything in between, sort of everything that sort of runs the gamut. So I've been fairly fortunate that most of the doctors that I have collaborated with on patient cases have been fairly receptive, where they will be like, okay, well, you know what? Um, for example, I have this one patient who was doing essentially chemotherapy and sort of periodically, and they were also taking TCM herbs at the same time, right? And so, not really sure about the interactions between the two, right? Because there's very limited studies on that, and so the compromise was reached that okay, 4 days before the patient was to receive chemotherapy, stop the herbs. After chemotherapy, wait 4 days, start them up again, right?
Right.
And that happened to work very well for the patient in terms of both the timing and the results. So that was quite good. And so, it is possible. And I think that, moving forward, I think there should be more collaboration between TCM and Western medicine. And sort of going back to what you were saying about before, where, TCM is very individualized, whereas Western medicine tends to be very sort of one size fits all. But you can also see that shift away from that in Western medicine, where there is a gradual shift towards more individualized care, right? And you see this a lot in the newest research, especially when it comes to, um, you know, uh, uh, newest research and even something as ubiquitous as, say, something like eczema, like skin rashing.
Yeah.
Um, there's a lot of new research in it, and the approach that they do now, especially in Asia, is very individualized. It's not like, okay, well, step one, try this cream.
The
Step two,
scream,
if that
right?
doesn't work, if it doesn't work, we'll go to pills. If pills doesn't work, we'll try this, we'll try this, we'll try this. Now it's more so looking at, hey, well, I mean, why is it in like, why is this patch of eczema just in this spot, right? And they start to ask questions about their lifestyle, about their everyday dealings, and that's exactly what we do in TCM,
Yeah.
right? And so there's sort of, that's the thing when you have two extremes, like even if they're far apart, and I'm not saying the TCM and Western medicine are very far apart, they have different approaches, but once you start working together, you get closer to the truth, right? You get closer to what works ultimately.
Right. So I'm going to ask that one, what may be a little controversial. So feel free to be like, I'm okay on that one. But because one of the things that I was thinking about, in terms of when trying to see where TCM fits the in the broader wellness space, right, is there is empirical research for a lot of preventative care and a lot of rehabilitative care, right? Which means that these are two places where TCM, particularly modalities like acupuncture, have got the empirical backing to say that they can formally fit within the Western medicine framework. But then there's another thing that I'm noticing, which is that, as you said, there's a shift in business approaching wellness. And that shift is actually integrating TCM concepts, but not giving the credit to TCM. Right. So this is the thing where, people talk about, and again, this is why I'm saying it's a bit controversial, but stay with me here, right? The concept of appropriation, right? So we hear about appropriation in many ways. And I'm concerned that this kind of behavior within Western medicine is appropriation because on one hand, they say TCM is alternative. TCM is pseudoscience. But then on the other hand, they take TCM concepts and integrate it into their practice to strengthen it. Right. So, like, again, I know controversial. So be like, sure, we're not going to go there. But if you do have any thoughts on the matter, I'd love to hear.
Sure. And that's a fair point, right? That's a fair point in terms of like things like appropriation and sort of giving credit where credit is due and all of that. To me, ultimately, for me personally, my personal opinion on that topic is that there's many different ways you can look at it, right? On the one hand, you can think that, oh, they are taking from TCM, not giving the credit, but strengthening their own position. Um, you know, yes, that certainly is an issue. But on the other hand, um, ultimately, if it is able to help someone by strengthening, one side or the other, I'm low key okay with that. I'm low key okay
Fair
with
enough.
that, right?
I think,
And
especially in Canada, where TCM practitioners and TCM doctors are fighting so hard to be recognized, right?
yeah,
I think that's where it becomes a little bit more concerning because we have people practicing a valid form of medicine
mhm,
that does have its space. It doesn't replace Western medicine,
yeah,
no, but it has its space in the medical realm.
yeah,
And instead of that space being respected, it's been treated like it's a thing, a fad, a sideline
sure,
thing.
yeah,
Meanwhile, you respect it enough to integrate it,
right,
not give it the credit.
right,
So I think that's where it's like, yes, I'm great. It's great that it's going to help, but on the other hand, if it's going to destroy an existing form of medicine in the
sure,
process, I mean,
yeah, yeah, and I mean, in terms of that, like, if you think about how different TCM is currently from how it was 100 years ago, 500 years ago, 1,000 years ago, 5,000 years ago, right? If we're talking about just within TCM, I mean, from the classic of, say, Shanghanlun and Jingui Yaole, which are two of the major classics, which were sort of written sometime in the Eastern Han Dynasty. We're talking about what 2,000 years ago or something like that, to all the way to the Qing Dynasty, which was only a couple few hundred years ago, right? There's been a huge shift in like back in the Shanghan, and Shanghan means injury by cold. Back then, it was believed that all diseases ultimately were caused by cold that then turned into heat, whereas later on, to sort of account for infectious diseases, there was this entirely new, at the time, new, now it's a few hundred years old, but still relatively new. About febrile diseases, infectious diseases. And so things evolve over time. Western medicine has evolved over time. Everything evolves over time. And I think collectively as humans, we are evolving as a species towards where, we're still kind of on the precipice of it, I think, where, back in the day, it's like, oh, I'm of this country, I'm of this culture, and, I'm proud of it, which is great, right? But collectively, I think that, being human, right? As we grow as a species, I don't think, like, let's say optimistically, a few hundred years, maybe takes a little longer, a few thousand years into the future of humans. Maybe by that time, there's no such thing as Western medicine or
Western
Chinese medicine. It's just medicine, right?
medicine.
It's just trying to get the human to feel better,
Yeah,
right?
right.
And it's just to get the human body to where we want it, right? Get it healthy. So ultimately, all of this, I think, is a part of where we're going. It's just growing pains, I think.
Perfect. Fair enough. Okay. Oh, very, very, very diplomatic of you. I like that. All right. So I guess Kat will go over now to the nitty gritty, the things that you can help us know a little bit more in terms of
Sure.
students and stuff.
So, I mean, first of all, thank you so much for your super insightful perspective on traditional Chinese medicine. And, it's one of the things that I love the most about traditional TCM, right? Because now that I've learned a thing or two about TCM, I've noticed that it is it is a science by in itself, because a science has to be observable and it has to be willing to upgrade and change itself over time. And that's exactly what TCM has been, you know, so far, as you have just mentioned, right? But even so, it is still the road less traveled, as you can say. So this is the segue into my section, into asking. A lot of our listeners, especially the students, they're curious about what practicing TCM could look like outside of the classroom. And as we've been told, right, being a TCM practitioner is more, it means that developing both your clinical skills and the practical ability to potentially run a business, because the work blends patient care with responsibilities of managing a practice. So I'm gonna ask you a few questions about your professional path. Did you start your clinic right after graduation, or did you gain experience working elsewhere first? How did your journey go?
So again, I feel that I've been very fortunate in my particular pathing. Starting a clinic is definitely not something that is easy. Um, and just like starting any business or entrepreneurial venture, there are risks you need to take, and financial risks, and to business risk, personal risks as well. It's a big scary world, right? And For me personally, when I first graduated, uh, I started working at a motor vehicle accident clinic, sort of a multidisciplinary clinic where you would have acupuncture, you would also have a chiropractor, physiotherapist, RMT, right? And then you would also have either speech therapy, and all these different um,
Modalities.
therapies, yeah, sort of coming together in the clinic. And that was that was something that I did. And then sort of at the same time, sort of in the same realm, maybe like a year or two after I started there, one of my former teachers was retiring. And so I was fortunate enough to sort of take over her practice. And sort of taking on her old patients, and so that was sort of a nice sort of transition for me. And it's a, what I will mention is once you first graduate and you started practicing on your own, because as you know, in our school, when you are in the teaching clinic, you've got your peers. Like when you're seeing the patient, you're seeing the patient with your peers. So you've got that sort of emotional support, you've got that knowledge support, right? You can kind of discuss the case. You've got a supervisor to discuss the case with, to confirm your diagnosis. You've got all this backing.
Yeah.
All of a sudden, after you graduate, all that's gone,
On you.
right?
Yeah.
You're just kind of on your own. You're just kind of like, ooh, okay, you know. And you do miss that, right? The first few patients that you see, you're just kind of like, hey, oh, right, there's no one there, right? It's like, what do
Right.
you got? Oh, right, okay, yeah. So you don't really have that sort of soundboard, that sort of backing that you used to have. And so, but that's again sort of a very good opportunity for you to sort of grow and learn and sort of grow into your own style of practicing the medicine, because everyone's a little bit different. Everyone does TCM a little different. And so you kind of grow your own sort of TCM personality, so to speak, right? And I think that as a new graduate, I do encourage you to sort of work at a uh, like an established clinic, right? And multiple established clinics if you can, just to see how people do things, right? How do you do the booking? How do you do patient retention? How do you do marketing? How do you set up your treatment room, right? How do you take notes and keep your notes, right? All of that is something that you can learn a lot sort of on the job, so to speak. So that when you go to open your own practice, you at least have that experience behind you. I think that is very, very crucial. Yeah.
So when you first started working for the multidiscipline clinic, as well as when you first started taking over your ex-mentor slash teacher's clinic, was there like a big kind of lesson that you've learned? Like maybe something that it was interesting to you or something you wished you kind of did a little bit differently? Because, as learning in a classroom versus doing it in real life practice is totally different things, right? So like,
Absolutely.
could you just kind of give us a little bit insight about that?
Um, Ooh, boy, that's a big topic. Um, Something that I guess can mention would be um, be coachable.
Mm-hmm.
Be coachable. Because and this is something that you should try to keep, right, as you progress through your career. I think it's important to be coachable and stay coachable, because um, everyone has blind spots, right? Everyone has blind spots, and especially when you're first starting out, your blind spots are huge. Like you think you're doing one thing, but other people looking at you like, what are you doing? Right?
Yeah.
You might be thinking, oh yeah, I'm doing really well, but then you're like, oh, okay, actually. And sometimes, as you grow, and this is just something in general, right? It's not just for building a practice. You kind of think back to how you were like maybe 10 years ago or 20 years ago. You're just kind of like cringing because, oh wow, like that, I didn't know better, right? I didn't know better. And so I would say, like, try to sort of have as broad a view as you can. I think trying to learn about things, like not just within, like, don't just focus on your own part, right? This is your TCM knowledge and all of that. That's great, and that will continue to grow because that is what you use day in, day out. But there are many other things that are related to your practice in ways that you never thought of, right? It could be as simple as something like a patient comes in, and and when they come in with their chief complaint, right? This is why they come to see you. This is the condition, what they're experiencing. One of the first things that we try to establish as TCM practitioners when during our diagnosis is what we call etiology and pathogenesis, right? So something triggered the condition that they're having. And from that one trigger, it sort of progressed into how they are right now in front of you, right? And um, sometimes you come across something that is so obscure. Like the patient might say, like, "Oh yeah, I was doing base jumping, and I got altitude sickness and da da da, and I did this and I landed and then I landed funny." And like there's just all these things that about life in general. Because again, remember that TCM is a holistic medicine. We kind of have to take apart their lifestyle. Like you kind of look at everything that they do, and once you start really looking at what people do, you're like, wow, I didn't know people did that.
Right.
Right. So even something like that. So it's I would say just sort of try to broaden your horizons as much as possible. I think that makes you more adaptable. And especially when you're trying to grow your practice, you kind of have to have that adaptability. And the more things that you have at least heard of, then you're not just kind of caught off guard. I think that's something that I can say is as a very sort of general thing that I think everyone can benefit from.
Amazing.
So just to build off of that, personally, as a first semester student, right, it's still taking me a lot of time to kind of wrap my head around the different TCM concept. For example, one disease could have multiple syndrome differentiation, so like the different causes per se, right? So the wind dam, wind heat, yada yada yada. So for me, even as a student, sometimes it's hard to wrap my head around it. So if a patient who comes to you who doesn't really understand the diagnosis from a TCM perspective, how do you go about communicating with them to kind of help them understand it?
So again, I have to say that I'm very fortunate in that as having the opportunity to teach students,
Mm-hmm.
especially like teaching the introductory courses a lot of the time, and that's exactly what I do is students come in and I'm trying to explain this theory to them in terms that they can understand. And I think that has definitely helped me in that regard. Sort of going back to the question of how do you go about explaining the concepts to a patient who is obviously a layperson and not really, knowledgeable in TCM. Like, how do you go about doing that? And I will say that, I think that you should try to explain it as much as you can to the patient, right? For on the one hand, yes, so that they know what's going on and that they are informed of what it is that you're doing for them. But on the other hand, explaining it helps you to deepen your knowledge as well, right?
Right.
Explaining it helps you to sort of think about how I can explain it in a different way from a different perspective, but still staying true to the theory, right? Um, and so, and you'll get patients that are super interested. Oh yeah, tell me more. And then there's patients just kind of like, can we just get started with the
Can we just do it
TCM?
now? Yeah.
Just I'm gonna lie down. You do your thing. I don't really need to know about all this stuff,
Yeah.
right? So you'll get that as well. But I find when you're explaining things to the patient, I think what's very important is the use of analogies,
Mm.
um, trying to understand, and that's also going into understanding them as a person, right? From their perspective, you know, the way that you would explain TCM theory to a 5-year-old child
Right.
versus a computer engineer versus an artist,
Mm.
right? You would use different terminology, you would use different analogies. And I think, and again, that goes back to your being able to be adaptable is the more you know about it, the more things you know about, the more you're able to sort of think about it from their perspective. Right. And then you come back to the TCM and you're like, okay, well, it's kind of like, oh, you're an artist. And, we have warm colors, we have cool colors, and that's kind of like your yin and your yang. And that, so you can use things like that that help them to understand the theory. And I think that it also helps you to build rapport with the patient as well. And say, hey, you actually understand me. I kind of trust you a little bit more now. And patient trust, patient retention, that goes back to sort of the business practice and all that. But even them trusting you more as a practitioner the outcome of the treatment is also better as well. So I think that's a very good point of you sort of you're asking this question is, um, being able to explain it is not just keeping the patient informed, it's also demonstrating that, hey, I understand you, I get you, this is what's going on, this is how we'll fix you, right? It's kind of reassuring for the patient as well.
100%.
That's true. Yeah.
Thank you so much. Yeah, very helpful. And just one fun question to wrap up this section.
Sure.
If someone were to hand you $1,000 right now, someone, maybe not us, but someone, to improve your clinic, right? How would you allocate it?
Oh, that's an interesting question. Um, uh,
Take your time. It could be in marketing. It could be stocking up your herbs inventory. And
yeah, I mean, those would definitely be the sort of a practical approach. Um, one thing I've always wanted to sort of explore, uh, which I haven't really had the opportunity to because it is a little bit cost prohibitive, is laser acupuncture.
Oh,
Yeah, so instead of using needles, because obviously needles work, they've been using them for thousands of years. But the other issue is that not everybody likes needles.
like
Actually, most
needles,
people
right?
don't. Right? Most people don't. And they're like, and I find that there is a lot of apprehension um, to needling, and you kind of have to be very patient with your patients and just kind of baby steps, like, hey, like, it's not that bad, it's really really thin, explain the whole thing, which is great. But then ultimately there still are some people that are just way too apprehensive, way too nervous about it. And I think that laser acupuncture is something that would be that I think would be interesting to sort of go into. $1,000 wouldn't, I don't think that you'd be
You're
able to
close to
get a
that,
unit.
right?
But it's
with a
helpful,
dream.
a little step
Yeah.
towards that. Yeah.
That's amazing. I didn't even know about laser acupuncture. I did see
Yeah,
a
yeah.
study recently about auricular,
Hmm.
and technically not acupuncture, but it's same concept. It had to do with electrical
Hmm. Yeah,
like thing, and it had to do with epilepsy. So
yeah.
basically, and I'm thinking, wait a minute, again, TCM. This is why I think I get a little bit like, I'm like, TCM.
Yeah.
Anyway, but yeah, that's amazing. Okay, so now let's see. Do you have any advice for students? So again, we're both first year. I'm in just in my second semester.
I'm in my first.
I'm loving the theory. I'm still wrapping my head around the acupuncture, and I think the whole needles thing is actually a thing on that part. But I'm loving the theory. Very excited. Um, but is there any advice that you would have for students who are hoping to become TCM practitioners, especially those that are interested? Because I think a lot of people are interested in getting into healing practices, in getting into medicine,
Yeah.
and may not even realize that this is a way that you can help people, and a very holistic way that you can help people too. Would there be any kind of advice that you would have if they're feeling overwhelmed? How they might, I guess, what advice would you have for such students?
Sure. I mean, learning TCM, learning to become a practitioner is by virtue of it, because the theory is um, simple but very abstract, which makes it powerful, because when the simpler a theory is, the more adaptable, the more applicable it is to many different situations. But that also makes it difficult to wrap your head around. And what I will say is that um, when you feel overwhelmed, that's normal, right? If you are learning TCM and you're not overwhelmed at least a few times, you're doing something wrong. And then that's really the case with learning anything, really. But especially with TCM, I find that um, being overwhelmed and getting confused and thinking you know what it is, but then all of a sudden you just meet this one thing and it just all comes crashing down again, and you feel like you're in first semester again,
Yeah,
right?
yeah.
That's a huge part of it. And what I will say is that just be confident that if you feel confused, you're on the right track. Okay,
Well, thank you.
if you feel confused, you're on the right track.
I'm on the right track.
Because because I tell patients, or not patients, I tell students this all the time. The way that TCM education works is we are giving you pieces of a puzzle,
Mm,
but it's not like when you're doing a puzzle. When you do a puzzle, on the front of the box, you can see what the puzzle is going to look like once you're finished. In TCM, you don't get that. You don't get to see what the finished product is because you're still building it. You're still building it. You don't get to see what the final product is, but we're giving you little pieces. And you're looking, okay, this, okay. And you're just getting all these different pieces. You might not understand them. You might not even know what it is. You might not know where it goes in this puzzle. But as you get more and more pieces, you're going to start making these connections. You can put one to the next to the next. And once those moments, those eureka light bulb moments, those are when you do some real learning. You're just kind of like, oh yeah, okay, now I get it.
now I
Right.
get
And now I know why you said that. Oh yeah, back in first semester, I had no idea what that means. Oh, that's what you were talking about. It's those moments that really sort of catapult you forward because now you have the knowledge. It's just now it's accessible to you. Right. And so I would say keep at it. Like keep taking these small little pieces, keep taking them. Eventually you'll have enough to build your own puzzle.
amazing.
Beautiful.
Okay. All right. So I have to say, yeah, that was kind of exciting. I know I went on a full tangent. I wasn't supposed to go there, but it's
Well,
I'm
we
like,
could sit here all day, right?
thank you for everything.
Absolutely.
Anything else that you want to cover? I think we've covered most
Yeah,
of
we
what
covered most of them. I just want to say thank you so much for your time again, Eric.
Absolutely. Thank you very much for having me.
For sure.
And yeah, so we're hoping to speak to other. Oh, actually, let's talk for a quick second about
Yeah.
the professor aspect of it. So
Sorry
you
about
did,
the
about the teaching aspect of it, because
yes.
you did mention that it's actually kind of helpful in learning how to dumb it down for students. It also helps you explain it better for patients. Um, when it comes to having students from a Western medicine background, because again in class that's where I've noticed we hit the most blocks in helping that kind of switch over, particularly getting out of the diagnosis mindset, right?
Mhm.
The
Yeah.
this disease, how do we deal with this?
Yeah.
What I'm wondering if there's a way that we could preemptively have people leave that away, behind. You know what I mean? It's just like walk out, like leave that out of the door when you come into this. Um, do you think there'd be a way that we can, like, as a professor, one can comfortably have a student just,
Sort of
alone?
um um honestly I think that's hard. I think that's difficult, mainly because um you are who you are because of your experiences,
Yeah,
right? Because of what you've gone through in life. That's what makes you you. So what you bring to TCM um is and if you come from a sort of Western medical background, that's what you bring to the table. And I don't think that should be viewed as a weakness or a hindrance. I think that it can be a very powerful advantage. And I think that as a student, um, um, if you have that, you should use it to your advantage. Try to and that's the thing about keeping an open mind,
yeah,
right? And you know, being able to see the possibility, right? If you know, your knowledge is here, you're just simply adding to the knowledge,
right,
right? And it comes back to the whole teacup philosophy, where there are how does it go? Learning is kind of like filling a teacup, right? If your teacup is already full, you're not
right,
learning anything,
right,
right?
right.
So it's not so much that you want to empty out your teacup and forget about it. It's more so maybe you have a little bit more room in that teacup, right?
Mm,
Make some more room, right? Use a bigger teacup, right? Get yourself a big mug, and have some more tea. So yeah, I think that it's not so much uh, uh, well. I guess from both sides, from the instructor or the school side, I guess we can encourage students to do that, but ultimately I think that it's more of an internal thing. It's
Yeah.
more of from the part of the student being able to have that awareness that
Mhm.
I know that I have a certain knowledge that I bring to the table, and how can I move forward? Because if you're here at the school, if you're learning TCM, that means that you're interested in it,
Mhm.
but you can't let your past experiences really prevent you from learning it. You
Okay.
have to sort of find a way that you can sort of accept
Yeah.
the new stuff, but not contradict the old stuff, right? Even though they sometimes are contradictory, you have to find a way that kind of reconcile that in your mind, right? And if you can't, just temporarily keep them separate, right? As I said, everyone is growing and evolving. Maybe one day you'll be able to come to a resolution between the two.
Figure out how they do. Yeah,
Mm.
because okay, beautiful. Because that's what I think I noticed, and I do know there are many, Western background students who are very eager and interested, but they keep
Yeah.
almost getting frustrated with not being able to reconcile.
And that kind of goes back to sort of that piece, that puzzle analogy that I was telling you about. Especially when you first start and you only have like one or two pieces of the puzzle, and you're trying to sort of make sense of where it goes based on what you know previously. um, those may not connect to what your knowledge is, right? There's a couple of pieces away, like this is where your knowledge is, and you're trying to build pieces here, but this piece belongs all the way over here, right? And you need to grab all the different pieces that then can connect you to that one piece that you just got. So be patient. Be patient.
I think the overall story here is, especially when you're starting out, be patient.
Be patient, right? Be patient.
Okay, amazing. All right, so shall we
Beautiful. Shall we? Yep.
wrap it up?
Yeah.
Okay. All right, so then I guess we'll be wrapping it up. Thank you again, Aric,
Absolutely.
for joining us today, and for everyone listening, thank you for joining us for the first episode of the Meridian Walk Podcast.
And we'll be back with more conversations, more stories, and more wisdom from the world of traditional Chinese medicine. And until next time,
Bye.